Morning, dear students. In the anatomy of heart, we have to start with the chambers of the heart. Then we have to deal with the walls of the heart. Then the coronary circulation, and the fourth one is conduction system of heart, and the fifth one is nerve supply of the heart. Let's go with the chambers of the heart. Okay. If you look at the cross section of the heart, you will find chambers, 4 chambers inside the heart. There are right-sided 2 chambers and left-sided 2 chambers to the heart. The right side of the heart means the right side of the patient in front of us, and the left side of the heart means the left side of the patient in front of us. Anyway, I have shown 2 chambers with blue color that represent right atria and right ventricle, which carries the deoxygenated blood. And I have shaded 2 chambers, the left atria and left ventricle, with red color because it carries oxygenated blood. So the 4 chambers of the heart are right atria, right ventricle, and left atria and left ventricle. Okay. What I told you is the right atria and right ventricle, which carries deoxygenated blood, act as one pump. You can see here, right atria, right ventricle act as one pump which carry deoxygenated blood, whereas left atrium and left ventricle, which carry oxygenated blood, act as another pump. So heart is a double pump. You understood? Let me write the point. Heart is a double pump. You can write with me. Heart is a double pump. One pump here and another pump here. Okay. Heart is a double pump. Now, let me ask you, why these upper 2 things are called atria and these lower 2 things are called ventricle? Whatever may be the right or left, the upper 2 things are atria and the lower 2 things are ventricle, because the upper 2 things, the right atria and left atria, the atria contract together, and the lower 2 things, the ventricle, contract together. So, 2 atrias contract together and then the 2 ventricle contract together. Which will be most forceful contraction? You see, the 2 atrias actually act as a priming pump, whereas the 2 ventricle, which have thick wall, act as the main pump in the heart. So, which is the main pump? The main pump is actually the 2 right ventricle and the left ventricle, whereas the priming pump are right atria and right ventricle. Sorry, right atria and left atria. Okay. Now, out of the 4 chambers of the heart, which will be the most powerful chamber? It's actually our left ventricle, because the left ventricle have very, very thick wall. The left ventricle pump forcefully to all part of the body. Therefore, left ventricle is the thickest part in the thickest powerful chamber inside the heart. So that's all about the chambers of the heart. We completed the chambers of the heart. Now we have to look the walls of the heart. In the walls of the heart, there are 3 walls. The outer epicardium, middle myocardium, and the inner endocardium. Actually, the endocardium and myocardium are thin walls, but compared to this wall, the myocardium, the middle myocardium, is the thickest wall. It is the muscle layer of the heart. It is the wall which make the forceful contraction, beating of the heart. So there are 3 walls: outer epicardium, myocardium in middle, and the inner endocardium. Okay, which is the thickest wall? It is the myocardium. And more than that, I want to repeat that, which is the thickest chamber of the heart? It's left ventricle. Okay. Now let's go to the third subtopic we have to discuss. That is about coronary circulation. In the coronary circulation, when we talk about coronary circulation, there are arteries which supplies to the heart. I mean, the heart is a supplier of blood to all organs. But just like every organ, the heart also needs some blood that is supplied by characteristic artery known as coronary artery. More than that, just like all organs, there are venous drainage to heart also. And more than that, there is lymphatic drainage also. So, under the coronary circulation, we can divide the topic into coronary arteries, coronary veins, and lymphatic drainage. I am talking you about coronary arteries. When you think about coronary arteries, I want to tell you about aorta and inferior and superior vena cava. In the photo of heart, I have shown with blue color about the superior vena cava and inferior vena cava. That's actually the blood vessel which brings the blood into the heart. Whereas I have shown with red color about the aorta. Aorta is actually the pumped blood is going out through the aorta. And what is about coronary arteries? Coronary arteries actually arising from the base of the aorta. I mean from the root of the aorta. From the root of the aorta, the major blood vessel aorta, from the root of this aorta, there is a artery arises to the right side. We call it as right coronary artery. And to the left side, there is another artery, main artery. We call it as left coronary artery. Simply, in conclusion, from the root of aorta, the right side, there is right coronary artery. And to the left side, you can see the left coronary artery. I have marked in this photo. Okay, look at the photo now. The right coronary artery supplies to right atrium, right ventricle, and SA node and AV node. Okay, again, right coronary artery supplies to right atrium, right ventricle, and SA node and AV node. Whereas the left coronary artery supplies to left atrium and left ventricle. We can go in detail about that. Now look at the photo. You can see the right coronary artery has several branches. Just like that, the left coronary artery has also several branches. We can study the branches one by one. Okay, basically I want to tell that there are two coronary artery, right coronary artery and left coronary artery. Okay, we are starting the branches of arteries. Let's trace the right coronary artery. When you trace the right coronary artery downwards, you can see that at the margin you can see a large branch. It is known as the right coronary artery branch is known as right marginal artery. The right coronary artery, when we trace downward, at the margin you can see a branch which is known as right marginal artery. Okay, the branch at the margin of right coronary artery. Right marginal artery. Let's list up the branches of right coronary artery. 1. Right marginal artery. Second one, I told you that there are AV node and SA node supplied by the branches of the right coronary artery. So the second one is AV nodal artery. The third one is another name, posterior interventricular artery. I will teach you that. Posterior interventricular artery, or in other ways it is called posterior descending artery. Let's look that. Before that, we have to write these three branches. Okay. The branches of right coronary artery are 1. Right marginal artery. Second one, AV nodal artery. Third one, posterior interventricular artery. Okay, I mean it is also called a posterior descending artery. These are the 1, 2, 3. Right marginal, right AV nodal artery, and posterior interventricular artery. These are the 3 arteries of our right coronary artery. You can note it down. Okay. Now, what is posterior interventricular artery? That is posterior descending artery. For that, I have shown you a cross section of heart. You can see the 2 ventricle, right and left ventricle, and the interventricular septum, very thick interventricular septum in between that. When you look at the interventricular septum, at the posterior side of interventricular septum is supplied by posterior interventricular artery. Just like that, the anterior part of interventricular septum is supplied by anterior interventricular artery. Actually, the posterior interventricular artery, I have rounded that, it's actually the branch of right coronary artery, and the anterior interventricular artery or anterior descending artery is a branch of left coronary artery. You understood? Again, I am repeating. Anterior interventricular artery is a branch of left coronary artery, and posterior interventricular artery is actually a branch of right coronary artery. Now, let's conclude the branches of right coronary artery. Right marginal artery, AV nodal artery, posterior interventricular, or what we call posterior descending artery. Okay, just like our right coronary artery, there is also our left coronary artery also there. Okay, now when we consider the right coronary artery, we understood the branches. Just like that, we can also consider the branches of left coronary artery. Okay, now let's deal with the left coronary artery. When we think about the left coronary artery, first of all, I am listing all the branches of our left coronary artery. There are two main branches. The one is a large branch, we call it as left circumflex branch, and the second one corresponding to our posterior interventricular artery. In the left coronary artery, you can see anterior interventricular artery or anterior descending artery. See, I want to tell you that there are two branches to the left coronary artery. One is left circumflex and other one is left, anterior interventricular artery. Okay. And there are several sub branches to these two branches, and it is actually comparable to our right coronary artery. Let's deal one by one. Okay, simply I am telling that two branches are there. One is a large branch, we call it as left circumflex, and the second one, we call it as anterior interventricular artery, which is corresponding to our posterior interventricular artery of right coronary artery. Let's deal with the sub branches of these main branches. Okay, let's deal with the first branching of our left coronary artery. First, we can compare with our right coronary artery. In the case of right coronary artery, it is from the right coronary artery, the right marginal artery arises directly. But in the case of left coronary artery, there is a large branch, namely left circumflex. I have rounded, that's left circumflex artery, and which is then subdivided into left marginal. Actually, right marginal is there and left marginal is there, but left marginal is formed from as a sub branch of our circumflex. I mean, first left coronary artery divide a main branch into circumflex, and the circumflex again give rise to what? Our left marginal. But in the case of right coronary artery, the right marginal artery directly arising from the right coronary artery. You understood? Left circumflex is there. The left circumflex further subdivide into what? Subdivide into our left marginal artery. Okay, that's all about the first branch of our left coronary artery. Now let's think about the second branch of our left coronary artery. What is that? It's actually anterior interventricular artery or anterior descending artery. Okay. When you think about anterior descending artery, just like our posterior descending artery of right coronary artery, it supplies to interventricular septum. One is at the posterior, another one is at the anterior. Whatever may be, this artery has also several branches. In addition to supplying to interventricular septum, it also supplies another region. So, what branches of anterior interventricular artery supplies to interventricular septum means the septal branch of anterior interventricular artery supplies to interventricular septum. Septal branch of anterior interventricular artery. In addition to this, there is also another branch. It is known as diagonal branch. Here you can see the diagonal branch. What I told you yet? I told you that the anterior interventricular artery septal branch is there and diagonal branch is there. You can see the diagonal branch here. I can also inspect all other branches of our right coronary artery and left coronary artery. Okay. You can write in your notebook the branches of left coronary artery are 1. Left circumflex artery, and branches of this left circumflex artery is left marginal artery, and the second one is anterior interventricular artery and has two branches, the main branch septal branches and also the diagonal branches. Okay, diagonal branches. This is about the left coronary artery. You can see here left circumflex give rise to left marginal and anterior interventricular give rise to septal branch as well as diagonal branch. Okay. Now let me repeat again. The branches of right coronary artery are 1. Right marginal, 2. IV nodal, and 3. What is 3? Posterior interventricular artery. Okay, 3 branches. One is right marginal, second one is AV nodal, and third one is posterior interventricular artery or posterior descending artery. Just like that, the branches of left coronary artery are first main branch left circumflex, which subdivided into left marginal, and the second main branch anterior interventricular artery or anterior descending artery, which divide into septal and diagonal branches. You can see the anterior interventricular artery. First we have to tell posterior. I am sorry for that. Posterior interventricular artery and anterior interventricular artery supplying our interventricular septum very clearly in this diagram, in this photo. You can see in the interventricular septum, the anterior interventricular artery, septal branch of anterior interventricular artery, and the posterior interventricular artery is supplying the interventricular septum. You can see the anterior interventricular artery. First we have to tell posterior. I'm sorry for that. Posterior interventricular artery and anterior interventricular artery supplying our interventricular septum very clearly in this diagram, in this photo. You can see in the interventricular septum, the anterior interventricular artery, septal branch of anterior interventricular artery, and the posterior interventricular artery is supplying the interventricular septum. Okay, students, now let's consider the other topic. I mean, under the coronary circulation, we first covered what? Coronary arteries. The next topic is coronary vein. So let's go to the coronary veins. What I have to tell you is that the coronary veins are following the coronary artery. In the diagram, you can easily say that, the red colored coronary artery is followed by the blue colored our coronary veins. So the point is coronary veins follows the coronary arteries. Okay, now where does this coronary veins goes? Actually, the coronary artery is coming from the root of aorta. Then where does this coronary veins drains and give this blood to where? We have to discuss that. Coronary veins, generally we can call it as cardiac vein, drains to a chamber over the surface of heart. We call it as coronary sinus. Let me tell you again. The coronary veins, or almost all cardiac vein, directly drains to a chamber known as coronary sinus. And the coronary sinus, where it drains to? Which chamber? Is it right atrium, right ventricle, left atrium, left ventricle, or vena cava, or aorta? We have to tell that. We have to discuss. You know the fact that blood from the coronary sinus, blood from the common chamber drains to our right atrium. Just like our vena cava, superior vena cava, inferior vena cava drains to our right atrium, the blood from the coronary sinus also drains to our right atrium. Now, you understood? Are you okay? Let's again take the common topic, I mean coronary circulation. We discussed coronary arteries, we discussed coronary veins. Now we have to discuss what is the lymphatic drainage in the in the heart. Lymphatic drainage of heart. The third subtopic, lymphatic drainage our coronary artery and vein. The lymphatic vessels also run along with our coronary vessel. I mean artery and vein. So coronary artery, coronary vein and lymphatics run together in the heart. After draining from the heart, where does this lymph goes? Actually, this lymph drains to the longest lymphatic duct in our body known as long thoracic duct. So lymphatics drains to long thoracic duct. Let me conclude. The veins will drains to coronary sinus, lymphatic will drains to thoracic duct, and the arteries which supplies the heart actually arises from the root of aorta. Again, come back to our topic distribution under anatomy of heart. We completed the chambers of heart. We completed the layers or walls of the heart. We completed the coronary circulation in which artery, veins and lymphatic drainages are present. More than that, the fourth topic we have to discuss is actually the conduction system of the heart. You can see here about the conductive system of the heart, conduction system of the heart. In the conduction of system of heart, first thing I want to describe you about the SA node. You can see on the right atrium an SA node, a nervous tissue, SA node, specialized muscle tissue, SA node is present. SA node is the pacemaker of the heart. Why SA node is called the pacemaker of the heart? Because electrical discharge, first under normal condition, is originating from the SA node. SA node can produce its own current, its own impulse, its own depolarization wave, or its own action potential. I will describe all these terms later. Anyway, SA node is the generation of action potential. This SA node is located on the right atrium, more specifically at the junction of superior vena cava and right atrium. Okay, SA node can produce impulses. SA node can make current that is responsible for the contraction of the heart in a whole part of the heart. From SA node, there is atrial conduction. From that atrial conduction, there is AV node. From AV node, the impulses are going to bundle of His and the Purkinje fibers. Let me tell you again. First SA node, sinoatrial node. Then atrial conduction. Then AV node. Then bundle of His. After that, the Purkinje fibers. We can go in detail about the thing. From SA node, there is atrial conduction. From that atrial conduction, there is AV node. From AV node, the impulses are going to bundle of His and the Purkinje fibers. Let me tell you again. First SA node, sinoatrial node, then atrial conduction, then AV node, then bundle of His. After that, the Purkinje fibers. We can go in detail. I have to mention before that is, here there is a insulation between atria and ventricle. I mean, atrias and ventricles are separated by an insulation. We call it that insulation as annulus fibrosus. Because of this annulus fibrosus, the impulses from the atria is not directly going to the ventricle. Actually, impulses from the atria is going to AV node only. From this AV node, it transferred into the bundle of His. And the other atria directly spreading to ventricle is not possible because of this insulation. What we call that insulation is annulus fibrosus. Here you can see an elaborated diagram of conduction system of heart. Actually, you can see the SA node, AV node, and the bundle of His. And more than that, this bundle of His is divided into further. We have to deal with that further subdivisions of our bundle of His. The bundle of His immediately divided into left bundle branch as well as right bundle branch. Bundle of His is dividing into left bundle branch as well as right bundle branch. And the left bundle branch further divide into anterior fascicles and posterior fascicle. So the branches are right bundle branch, anterior fascicle of left bundle branch, and the posterior fascicle of left bundle branch. Okay. And all these branches further divide into numerous Purkinje fibers, and the impulse through the Purkinje fibers are responsible for the rapid contraction of ventricles. Let's go back to our previous topic distribution. At first, we deal with the chambers of the heart, then walls of the heart, then the coronary circulation, and the fourth one was the conduction system of the heart. And finally, we have to deal with the nervous supply of the heart. So let's go to the nervous supply of heart. You can see that just like all other visceral organs, heart is also have a rich supply of nervous system. So you may think that heart has its own autonomous control. SA node is there, AV node is there, bundle of His is there, everything is there. Beyond that, in addition to influence this conduction system, SA node and AV node and everything like that, the heart has a rich supply of nervous system also, nerves distribution also. I have shown this yellow colored nerves. Actually, it's not yellow colored, but in the photo I have shown with a yellow colored is actually the nerves which is supplying to the heart. Okay. Now we have to know that what kind of nerves is actually speaking. Heart is innervated by two kinds of nervous system. One is sympathetic supply and another one is parasympathetic supply. The sympathetic and the parasympathetic have opposite action each other. For example, the sympathetic increases the heart rate whereas the parasympathetic decreases the heart rate. Let's go to details about this. Let's go in detail about this sympathetic and parasympathetic system. Students, we have to deal with the sympathetic supply of heart. For that, I just want to draw, just wait. I just want to draw a heart. In this heart, our sympathetic supply is, before that I want to show the SA node, AV node and bundle of His and our right and left bundle branches and our Purkinje fibers, everything like that. Okay, it's innervated by our conduction system. Okay, just wait. When it is innervated by our conduction system, I want to show you that, you know, this is our sympathetic supply. Sympathetic supply is innervating our conduction system. In addition to this, our sympathetic supply is also innervating the atria and the ventricle. I mean atria, ventricles, then what are the next thing? Conduction system. I mean AV node and SA node, everything is innervated by our sympathetic system. And I just want to show you a segment of cardiac tissue here. A segment of cardiac tissue here. Whatever may be, SA node or AV node or our atria, ventricle, whatever may be. And it is innervated by our sympathetic system. I'm showing that. Okay. You know another name of our sympathetic system? This is a nerve known as sympathetic nerve. Okay. You know another name for our sympathetic nerve is adrenergic nerve. Adrenergic nerve. Why it's called adrenergic nerve? Because it can produce adrenaline and noradrenaline here. It will produce adrenaline and noradrenaline here. At the end of this junction between myocytes and the sympathetic nerve, it will produce adrenaline or noradrenaline. So, in order to make a response at the cardiac muscle, there will be some receptors. There will be some molecule that can bind with this adrenaline and noradrenaline. We call it as receptors. You see, at the cardiac myocytes, you can see in order to bind this adrenaline and noradrenaline, there will be some receptors. What we call receptors. Okay, these receptors actually in the adrenergic nerve, there are two types of receptor: beta 1 receptor and beta 2 receptor. Okay, what I am telling, you see, you know, our cardiac muscle is innervated by what? Sympathetic fibers. It is not only innervating the conductive system, but also atria and ventricles are innervated by sympathetic nerve. Sympathetic nerve, in other words, called adrenergic nerve because it can secrete adrenaline and noradrenaline in its junction. Okay, and the adrenaline and noradrenaline able to act on this muscle by binding with a characteristic protein on the surface. We call it as receptors. Receptors on the cardiac myocytes. There are two kinds of receptor: beta 1 receptor and beta 2 receptor. Okay. Now the beta 1 receptor is responsible for positive ionotropic action and a positive chronotropic action. Chronotropic action. You may subscribe what are the you may have to know what is positive ionotropic action and positive chronotropic action. Actually, positive ionotropic action means increasing the force of the contraction, just like a muscle, increasing the force of contraction, we call it as positive ionotropic action. Whereas what is chronotropic action? Positive chronotropic action means increase in number of action potential, increase in number of ECG waves, increase in number of action potential generation, increase in the heart rate, we call it as positive chronotropic action. Simply increase in heart rate, we call it as positive chronotropic action. So let me repeat again. Heart is innervated by conduction system. Sympathetic nerve is innervating the conduction system, atria and ventricle and everywhere of the heart, and at the junction it will produce adrenaline and noradrenaline received by receptors known as beta 1 receptor and beta 2 receptor. They are proteins. Okay, now that they can make a chemical change and increase in chronotropic and positive chronotropic and ionotropic action on the heart muscle. So the positive ionotropic action is the force of contraction increasing, and the positive chronotropic action is the action potential generation increasing the heart rate. Okay, and what about beta 2? It will relax smooth muscles of blood vessel. Okay, that's why dilating the blood vessel. Okay, so beta 2 receptor do not have any role in heart rate. It will relax the smooth muscles of arteries and especially coronary artery, and will increases the blood flow, increases the vasodilation. Okay, so you understood there are atria, ventricle and everywhere innervated by adrenergic system, and it is secreting our sympathetic and parasympathetic it will secreting our adrenaline and noradrenaline, and beta 1 receptor and beta 2 is there, and beta 1 is the main receptor which have positive ionotropic and positive chronotropic, increase in the heart rate effect is there. So simply I want to tell you that positive inotropy, positive chronotropy are the characteristic of what? Our sympathetic system. What is inotropy? Force of contraction is increasing on the heart. What is chronotropy? Increase in the number of times of contraction. I mean, heart rate is increasing. So positive inotropy and positive chronotropy. Okay. Now you are able to understand what's given in these slides. Atria, ventricle, SN node is innervated by sympathetic nervous system, and there are beta 1 receptor and beta 2 receptor. Beta 1 receptor positive inotropy, positive chronotropy, whereas beta 2 receptor just vasodilation. Okay, more than that, one more thing I have to add. I have added there sympathetic supply. It supplies to atria, ventricle and conduction system. I mean AV node and SN node. Have you observed that during fever, exercise, emotion, our heart rate will increases? That's due to the sympathetic action. Now we have to discuss about parasympathetic action. While dealing with the parasympathetic system, what I want to tell you is that what makes the parasympathetic system different from our sympathetic system. Let's go one by one. Look at this photo. You see the heart is the parasympathetic nervous system is supplied through a vagus nerve. Vagus nerve is a cranial nerve. I mean a nerve arising from our brain. Okay, that's one difference. More than that, this parasympathetic supplies only to the SA node and AV node, not to the whole heart. Okay, more than that, I told you that in sympathetic system they secrete adrenaline. Here what they secrete is acetylcholine. Acetylcholine. And I told you in sympathetic system is working through beta 1 and beta 2 receptor. Here M1, M2, M3 receptors are there, means muscarinic. Out of this M1, M2, M3, this vagus nerve on the heart is acting on M2 receptor. Now let's think about the action. When you consider the action for sympathetic nervous system, it was positive inotropy and positive chronotropy. I told you force of contraction and rate of contraction. Whereas in parasympathetic system, there is negative dromotropy and negative chronotropy. What do you mean by negative chronotropy and negative dromotropy? Negative chronotropy, just like I told you, it will decreases the heart rate. In the sympathetic system, positive chronotropy means increasing the heart rate. So in the parasympathetic system, negative chronotropy means decreasing the heart rate. More than that, one more word is came. What is that? Negative dromotropy. That means decreasing the speed of the contraction. So parasympathetic system works by decreasing the speed of conduction on conductive tissue, and more than that, decreasing the less production of action potential. I mean decreasing the heart rate. So it's happened during taking a rest or taking during a deep breath or something like that. It will happen, and so that the vagal inhibition cause decreasing the heart rate. Close our anatomy. You can see if you are still confused with this chronotropy, inotropy, etc., this diagram will help you. You see, inotropy means our force of contraction, and chronotropy means the rate of impulse protection. I mean heart rate. Okay. More than that, a dromotropy, you can see the photo of scooter, the speed of conduction, and more than that, the bathmotropy. I think the bathmotropy means our excitability power of this muscle. Anyway, you just study that. Chronotropy, inotropy in sympathetic system, chronotropy and dromotropy in parasympathetic. In sympathetic system, plus chronotropy plus inotropy, whereas in parasympathetic, negative chronotropy and negative our dromotropy. Okay, I hope you understood. Otherwise, you can refer this photo, and more than that, this table, so that you will understand that. Chronotropy, inotropy, then chronotropy, dromotropy. That's all about the anatomy of heart, and we concluded that sympathetic and parasympathetic system. Hope you understood all things, and we will be with the physiology of heart in the next topic. So you understood all these things. First I told you what? First I told you about chambers of the heart, then walls of the heart, then what we discussed, then we discussed about our coronary circulation, in which arteries, veins and lymphatics are present. Fourth one about the conduction system, and the fifth one is about sympathetic and parasympathetic. Sympathetic will increase the heart rate, parasympathetic will decrease the heart rate. But you know, heart has an autonomic power, but when these nerves can influence this power. That's all about this thing. Hope you understood everything. In athletes, trained individual, there will be vagal inhibition, so that our heart rate will be low. Okay, that is not a pathology, that is normal. Okay, hope you understood well. Thank you for watching.